latest on the coronavirus. New numbers from the state health department show COVID cases are slightly going down. There are 98,000 new cases, and the test positivity rate has also dropped to just under 21%. But KPIX5's Kenny Choi reports on a key distinction people should be aware of during this surge.
Some leading health experts believe headlines highlighting the record number of hospitalizations can be misleading. The distinction between patients with COVID versus for COVID is even more critical during this surge.
A lot more patients come in for something that isn't Omicron, but they test positive. So you come in with a broken leg and, oh my gosh, you happen to have Omicron.
In San Francisco, 256 people were hospitalized with COVID last January. It's up to now 240. Health officials say a larger percentage these days, sometimes half of COVID hospitalizations, are patients seeking treatment for something non-COVID related, but then test positive and count as a COVID hospitalization.
Things have changed where, because it's so much more prevalent, it's so much more infectious, and it's causing less severe illness, that distinction is becoming more important.
Data shows 165 COVID deaths last January in San Francisco. This month, despite at least a four-fold increase in cases, only 5 deaths so far this month. But without a doubt, Bay Area hospitals are feeling the pressure of staffing shortages as a growing number of workers test positive.
Just like the rest of society, more and more healthcare workers are out because of quarantine isolation, caregiving needs, or because of illness.
Today, caregivers at Queen of the Valley protesting and demanding Napa's largest hospital improve recruitment with higher pay, saying staffing shortages are putting patients at risk.
It's not safe for them because we are short staff. We need a staff.
In Marin County this week, only 1 out of 1,000 positive cases end up in hospitals. About half of those are being treated for COVID and the other half admitted with COVID.
The protection of the vaccine is profound. It is protecting us. And we now are at the risk of some of the policies that had been appropriate in the past might actually tilt towards greater social harm for us collectively.
One hospital executive says a way to help emergency rooms during this overwhelming time is not to try and get tested at these facilities. In San Francisco, Kenny Choi, KPIX5.